tell us about you. You've got 2 minutes to try and sum up a pretty impressive career. What have you been
Okay,
up to?
I've been, as you all in the UK would call it, a veterinary nurse since 1976. So what is that, 43 years?
I wasn't even born then.
I know. Well, it doesn't surprise me. I mean, most of the people that I know are a lot younger than me. So anyway, so I've been a nurse for 43 years. I've seen a lot of animals. I've seen things change quite a bit in veterinary medicine because, when I got out of school, they didn't even consider pain to be that big a deal.
Right.
And in the 90s, I started working at a university. And even though it was lab animal medicine, they also do research on dogs and cats and monkeys. And so all of those are included. And there are regulations in the US that pain management is a big part of being able to conduct research.
Yeah.
So
Can I just get you to pause? Is there any way that you can put your phone somewhere so you don't move, just in case anybody's got a nervous disposition? They're going to struggle.
Okay, let me get my leg out of there. Let me see what I can do.
It's gonna drive people crazy because you keep doing this.
Okay, so I don't really have a stand, but I'm holding it, and I'll try and keep it still on my desk.
It's only in
Okay.
case somebody was like, it looks like you got a tick.
So anyway, I first became interested in pain management, and then I became very interested in it, and I joined that International Veterinary Academy of Pain Management.
Yep.
And that I was their executive secretary for 10 years.
Yep.
And I'm still involved with them, but now I've become more involved in speaking and writing.
Yeah.
And I've edited 2 textbooks. And I know, and written a lot of papers. And so pain management and geriatrics have become a large topic for me.
Yeah.
And
so I saw you've been on many webinars that I've watched, and what I really love, and the reason that I kind of reached out to you, is you've got that same passion for the geriatric that I have. So if I was in a waiting room and I was walking through to work, I will find myself going to the old dog over the puppy, and that's just who I am. It doesn't mean I don't like puppies, I do, but I love the older dears, and that's what we're going to talk about today. Cam originally got created for the older dudes, really felt that they weren't getting a huge amount of attention, and people were putting down these animals that could have had a little bit more attention earlier on. Often pain was being mistaken for just getting old, and Cam was created to try and give people a different insight to that assumption. What we're going to do today is, because I'm actually going to get Mary back loads, so we're just going to start today. A few things that I feel will help our followers that have a senior dog, because it was the hardest point for me with Holly. Holly got to 16, and the last 2.5 years were torture in many ways. And I thought tonight we would have a chance to talk about things such as caregiver burden. I really wanted us to talk about that whole concept of grief and how to manage it. Hospice and palliative care, which is a real forte of yours. I thought we might even try and touch on comorbidity, because a lot of people are managing dogs with multiple conditions. And then finally, if we get a chance, have a chat about euthanasia, because that is something that we all have got to come to terms with. So I'm going to get people to read Mary's bio on the advert. I'll put it on here again so you can realize how lucky we are. But are you happy to dive straight into caregiver burden and hospice care? Yeah?
Certainly,
Because
certainly.
I think you're more advanced out in the US. You've got a few things going with hospice care, haven't you?
Yes, absolutely. And something that for your viewers and followers that I can highly recommend is there are two websites, and they may want to write these down. One
Mm-hmm.
is called Lap of Love. It
Yeah.
was started by Dr. Danny McVady and Dr. Mary Gardner. They're both veterinarians. The woman that is in charge of their education and the veterinary aspect of their website is Dr. Sheila Robertson, who is a
Yeah.
good friend of mine. And Dr. Sheila she's from Scotland. She graduated from Glasgow University, and she's very active. She is boarded in animal welfare and in anesthesia and analgesia by the European colleges and the American colleges
You
of
know what? These
veterinary.
people that manage to do this, it amazes me.
Sheila has more credentials after her name than you can possibly imagine, and she is extremely compassionate and is perfect for these geriatric animals. You can contact her at Lap of Love, but people should look up that website. They should also look up the website International Association for Animal Hospice and Palliative Care. This is a group that is international. They have a board of directors. They have certification in hospice and palliative care.
Yeah.
And they lecture about this. They have a yearly conference, but they can also help owners. So those two particular websites I highly recommend for lay personnel and veterinary personnel. Go look them up and check them out. You can contact them. You can ask them any questions you possibly have. I'm not positive if Lap of Love has a European or United Kingdom counterpart. You
Yeah,
know,
I don't think it does. I've had a look before. I've looked up both of them, and they're both really useful, guys. Now, one of the things that I used Lap of Love for was when I was trying to read a bit more about quality of life and about assessment tools and about trying to decide when it's time. So one of the things that really stood out was the Lap of Love had a questionnaire that I referred to that helped me start being a bit more objective about where I was at with Holly, you know. And I think
yes.
what we'll do is let's take that as a lead to talk about this really difficult time. So I'm happy to abuse myself and talk about how difficult I found it. I'm scientific. I'm quite objective, and that went that went out the window. And I really struggled to distinguish improvement from deterioration. I struggled to work out whether she was in a good place, bad place. Was I keeping her for me, or was she going to come out the other side in a few days? And I think it was torture for both of us. Now, we've got a few tools that can help people out. You can go online and you can download these things for free. There's a few things that we've put onto CAM. So if you just want a quick hop jump onto the CAM website, we've got things like the good day, bad day diary. We've got client specific outcome measures. That's just touching on it. When you go to places like the Lap of Love, they have quite detailed questionnaires. You got something that you're going to show us?
No, I wanted to get to your website. Maybe you can tell me, oh, that's on Facebook. Okay. Why don't you tell me what ones you've got on CAM because do you have Jackie Reed's? Jackie
Yes, but mentioned
Reed,
I was going to talk about that one.
okay,
Yeah.
so she is magnificent and you can
I
get it.
know.
And so they help people all the time with quality of life tools.
Yeah.
It is normal. So all of the viewers should know when it comes to their own specific pet, it is normal for objectivity to go out the window.
It goes out the window, guys.
It's because this is your baby.
Yep.
This is your family member.
Yep.
And so it's something that you may have seen and lived with, and you think, oh, they're horrible. I'm going to have to, put them down, euthanize them. And it may actually not be as horrible as you think. It's just different from what you remember when they were 4, 6,
Yeah.
or even 8.
I
And
think I found that my mood really affected my judgment. And I think we don't realize how much we're being affected by not only seeing them, but there was also the physical burden of being with her all the time. I didn't want to leave her. I was tired because I was getting up in the middle of the night because I wanted to make sure she was still in her bed and not on a hard floor. You'd wake up and go, where is she? Is she going to be caught up in a corner somewhere? I felt very isolated because people didn't care as much as I cared. So I didn't go out, I didn't go on holiday. I was also ka-ching, ka-ching, ka-ching on my credit card. So I was actually preventing myself having any respite from it because I was spending all my money on her and isolating myself and becoming emotionally exhausted. So that meant I was really up and down. And if I was down, I would interpret her mood, movement, behavior really badly. But, give me a bit of relaxation or a gin and tonic, and I'd be like, oh no, she's not that bad. It's okay. So these objective tools can really help you. Let's stay with Vetmetrica because I'm more than happy to talk about this. I know that there's just been a paper that's been released. I think it was Joe Murrell's gang from Bristol. They were talking about it having less caregiver placebo effect because it's a digital tool. You can only go one direction. You can't review your reading. You can't meddle with your results. You can't fudge it. It's quite an accurate tool, and it's not just about physical health, it's about emotional health as well. So what it does, guys, is it gives you an email. So you basically set to how often you receive it. If you're in a really bad place, you could have it every other day. If you're in a not so bad place, you could have it every 3 months. And it asks you a series of questions that are very cleverly written. And they often are the same question asked twice, but in different words, and you don't know. So they make sure that you're not lying because they'll catch you out and ask you again later. And then it graphically represents where you are. And I'm a very visual person. I don't know. Are you, Mary? I like diagrams
and pictures. I
and
like
pictures.
pictures too.
Yeah,
So, that old adage, a picture's worth 1,000 words.
exactly.
A lot of times I like to be able to see and look at something. And yes, I like measurement tools, but I also like images and
Yeah,
pictures so that I can see, am I really looking at this the correct way? Is this animal as depressed as I think it is, or maybe it's not? The one thing we have to remember about our geriatric and older patients is they are going to appear different.
yeah,
There are huge changes in muscle,
mm,
skin.
mm,
So, uh, not only when I say skin, I don't mean just hair coat. I mean, the skin on their body is not as elastic. And
mm,
so we'll see this and think, oh, they're really miserable. Well, maybe they're not. This is
Yeah.
what happens as they get older.
Yeah.
And, you know, one of the technical terms that we have is called sarcopenia. And
Yeah.
so with that, that means muscle wasting or muscle.
Yeah.
It, 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 it's just the aging process where you don't look as good as you did. I mean, look at you, and then look
No,
at
not me
me.
today, thanks.
No,
No.
and look at me at 63 and see all this. I mean, see, it's different in,
41. When did
no,
this happen?
it's different in somebody. You know,
Yeah.
put up a 20-year-old next to me, and nobody questions that I'm an old lady now. So that's just a fact.
Well,
And
this
I
is the
think,
good thing about these tools is they don't just look at the physical, they look at the behavior. They bring different elements of your dog's life to help you guys be more objective. And I think that's really important. Just stay on this little tangent that you started. One of the problems that we have is that we don't have a way to show people when aging is allowed. And as you say, this is normal aging, the slightly slowing down, the slight change in morphology, body shape and appearance is acceptable, and when it's premature because there's a problem. And I can remember I was walking Holly and I thought, oh my God, we need to have a reference for every breed. And I was like, that's impossible. So we ended up doing a social media little video called Not Growing Old, not just growing old, great. And in the little video clip, we had dogs having a good time. So they were older dogs that were creaky, they moved badly, they looked old, but they still went and got the shoe from the front door. They still picked up their toy. They still came and greeted you. They still wanted to be part of the pack, the fun. And I think that's something that I would like you to take away from this section, is that when you're looking at your dog and you're stuck in that horrible place going, am I close? Am I not close? Where am I at? I know that this is a problem with aging. They come to the end of their life at some point. Try and break it down. You've got emotional and behavioral and happiness levels, and then you've got your physical capabilities. So are they able to get out and do the things they want? Are they enjoying their food? Are they enjoying their interactions with you? Do they have that autonomous kind of ability to independently do the things that they need to do? And that's where these tools, going back to where we started, can really help you out, because they break them down into the topics. Tell them about the HHHHM tool. Isn't that a guy who created a quality of life tool for cancer patients? And it was hunger, happiness.
you mean Alice Villalobos?
I think it might be.
She's the first person that started the HHHH, and it was a whole list that you could go down and look at it. It was the first time I had ever seen any kind of quality of life tool. So this is what, 10 years ago?
Yeah.
And it was wonderful, because if you look up Dr. Alice, and if I spell it correctly, it's VILLA
We can put this at the end. I'll write it
LOBOS.
down at the bottom. Yeah.
When you look it up, it will take you immediately to her scale that she developed. And it's wonderful, because people can look at it and they can go, well, I never thought of that before.
Yeah.
And things that you can see that are excellent. You will see your pet slow down. But with your quality of life, and as you have for this website with the osteoarthritis, at first it could be something basic like, let's treat it with fish oil for an omega-3 fatty acid. Let's put something on their food. Let's give a basic NSAID, because as they get older, they may get to where they can't take NSAIDs. And did you have your talk about CBD oil yet?
No, that's going to be
And
Sunday, and we're
Sunday.
going to do. I'll get you back to talk about that, because I'm going to do Stephen Sittal on Sunday from Elivet. Gwen Covey-Crump from Langford she's been talking to the Royal Society of Medical. She's been to some really good work there, so she's going to update us. And then we might get you back as well, if that's okay, because it's a different situation over in the US. But that's to come, guys. So yeah, let's just try and stay with the quality of life tools, and then we can move on with it.
All right. So
Because,
with the quality of life, with Alice Villalobos, she, like, basically for me, that I can remember, got everything started. And I think she also, it put Jackie Reed from Pain onto it, and Joe Merrill onto it. And there's somebody else besides the two of them that's a veterinarian in the UK.
Gonna hate you.
What? Oh, I know. So anyway,
their moment of fame, and you've forgotten their name.
Well, there's so many people that I just, in order to remember it, and you people will find out as you get old. See, the cognitive dysfunction with your old pet, it's normal, absolutely normal. And so,
well, you give me a brilliant tangent here. So we've talked a little bit of quality of life tools. We're going to come back to caregiver burden at the end, but you've just now talked about cognitive dysfunction, and that's on my list. So guys, I had a little list of the sort of things that I want to talk about. For me, with Holly, and one of the reasons that CAM exists is I never realized how difficult it was until I went there. And I think that is what many of the pain specialists that I now have the honor of, knowing and seeking advice from, is that they are very passionate about their topic because they didn't know until they got there. And this might be some people that suffer pain themselves, or they've witnessed their dog, cat, or somebody suffering. So what I also struggled with, Holly, was comorbidity. So for guys that don't know what that means, it means when you've got two conditions at the same time. My illustration for you, setting an example, is Holly had a really nasty liver tumour. So she had hepatocellular carcinoma at the age of 13. And I was at the other side of the table, so I can relate to an owner where you feel helpless, you're not really sure what to do. You've got a gigantic bill coming your way. You've got no promises of success. You have no idea whether you're going to rehab your way out of this. And I was basically told by a number of people, do you want to be in the room when we do the op? Because we don't know whether she's going to survive. And I was like, ah! So she did come through, but she left with a comorbidity. So she had lumbosacral disease, cervical disc disease, she had all of these, but she also had a dysfunctional liver. So we were managing chronic pain, but with the limitations of less ability to process the drugs that I was asking her to take. So we see this a lot. What can we do and talk about to help these people? On Holly's Army, our community group that we encourage you all to go to, there are owners that have got dogs that are on medication for chronic pain, be it spinal related pain, arthritic related pain, and they've got kidney disease, and they've got liver disease, or they've got inflammatory bowel disease, or they've got some other condition. It's really challenging, isn't it?
It's absolutely challenging. And here is something that I don't mind sharing. I have, in a week or two, I'm going to have surgery on my parathyroids.
Right.
Because I have a benign tumor on my two right parathyroids. Right. So what it has done is it has put me, I am in kidney disease, not kidney failure.
Right.
And it sucks all the calcium out of my bones. So I have osteoporosis and kidney disease. I'm not allowed to take NSAIDs anymore. And for my own osteoarthritis, I've lived with NSAIDs. So I can't do it anymore. And what am I going to do? So I've been the physicians have said, well, take acetaminophen. So is that paracetamol in the
Yeah,
UK? Okay.
yeah,
So I can still take that. And I've been pulled off calcium supplements because everything that I've been doing, this benign tumor has been sucking any calcium I've been putting in my body out.
right.
So they're hopeful that it will get better removing the tumor. But what if you do have the dog, like you just said? They're in renal disease. They can be in liver failure or renal or liver disease. They
Yeah,
can have heart problems.
yeah.
A lot of the medications that the veterinarian says, this will help and this will help and this will help, that's true. But what about the comorbidities? What if you can't take all those medications?
Yeah,
Then there are medications that, for instance, I love gabapentin. I
yeah,
also love amantadine. These
yeah,
are two drugs for chronic pain. They basically do little to disturb the liver, little to disturb the kidneys,
yeah,
and older pets can take them.
yeah.
But you also can do things that are wonderful to help with that quality of life and help
Well,
with the.
yeah, let's do that. We do this on cam. I didn't tell you about this. We do 10 top tips. And instead of leaving them to the end, we might chuck in the 10 top tips. And they're only like little snippets of advice. You do number 10, I do 9. You do 8, I do 7. You do 6, I do 5. Let's do that here now for comorbidity. And then we'll do it at the end for arthritis. But this works really well and it gives people a few facts quite quickly. So I'm going to start with number 10. When you've got comorbidity, you really need to find a vet that has your interests, your time. They're willing to give you that little bit of their presence. It might be via email, it might be by phone, it might be that they just always book your appointment at the end of surgery so it can go into the break and you can just have a bit more. 15 minutes quite often leaks into 30 minutes. You need that extra attention. So don't be embarrassed to fish around within your practice. Find that person that you bond with because you're going to need that help. Number 9 for you.
Which is number 9.
You can come up with a tip. Number 9.
Oh, okay. Let's see. Number 9, don't be afraid to look at alternative methods
Mm-hmm.
to help the pet,
Mm-hmm.
such as physical rehabilitation. So
Yes.
for the owner, let's say they don't have a lot of money. Can they learn things to do to help with their pet that can help with keeping down comorbidities just because of medication?
Mm-hmm.
So, if you do things like the pet's old and creaky, you can put warmth on their joints. You can provide an orthopedic bed for them. Things
Perfect.
like that don't cost huge amounts of money.
No.
Even if you don't have the money to go out and buy an orthopedic bed, people can put a bunch of blankets one on top of the other, and or blankets on top of the pet bed that they currently have. Help keep the pet warm. Don't overheat them,
Yeah.
but help keep them warm, help them to be able to relax and don't get things so stressed around them. There are lots of things that
You're
can
peering
be.
into number 7. Slow down. You've got a few more to go. I'm going to go number 8. If you've got a pet with comorbidity, so you're juggling multiple conditions, don't get sucked in to these ridiculous promises. So this is a little bit of a pet hate of mine. I go online and I see outlandish claims from unregulated products. Be wise, speak ideally to your vet and work out what is ahead of you. So say you've got a dog that has got arthritis and it's got kidney disease. Ideally, we need to be watching that dog's urine and blood throughout the year. So there's going to be a few expenses ahead of you. Don't blow your wad of cash on buying some Hooray Henry ridiculous products online 11 o'clock at night on your iPad because you'll want to do something. Budget, plan, don't get sucked into false promises. Okay, number 7 for you.
Okay. So don't buy a lot of needless products. Don't expect more out of them than they are capable of giving.
Okay.
Because as an older pet, I mean, you know, think of it this way. You go on and look at the Olympics and you see who the athletes are in gymnastics and stuff like that. They're all teenagers. So do you have anybody on there that's 85 doing anything? You know, no. So don't expect them to do something that is they're incapable of doing. And I can honestly say there are, I'm pretty sure the UK would have this too. Let's say you've done agility with your pet all their life. Now they're geriatric. They're not going to be in the speed class anymore. They may have something. I remember seeing a video of a client that had a Newfoundland and a Mastiff. Now, if you think about the little bitty dog and how fast they can go through an agility course, and then think about a Mastiff going through the course, and this guy was really trying, and he just kind of plodded along. Well, the geriatric pet may be that way.
We have hoopers over here. It's a very low level and it's going through the obstacles but with no impact forces, so they're not expected to jump and climb and clear, but they're expected to kind of target and travel distance, which I think is really good.
And think of a pet that, let's say you go to get the mail, and let's say your mailbox, and so not everybody would have this. Some people have their mail right outside their house, your door, you know.
We don't have that in the UK.
You don't? Well,
we don't have those cute little mailbox things with the little flaggy things.
Well, I used to live on considerable property, and it was, you know, an eighth of a mile, a quarter of a mile to get to the mailbox. Well, when you start out with your dog, maybe you can walk a little bit of the way, and then you want to stop because you don't want to push. You know, the animal, they may not be capable of doing that. So you have to be realistic in your goals and hope. And
I think that's a good one. I'm going to shift on to number 6. I think number 6 for me, as you say, be realistic with your goals, but also we have a phrase, it's not the end of the road, it's just the start of a new direction. So, you know, what we need to do is leave behind that belief that dogs love balls and bones and they have to be running at high speed to have a great life. Move and change your hobbies with them. So, you know, if that means you start, as you say, changing your path, your route, don't do hills when flat might be better. Don't do beach when grassland might be better. Maybe leave the tarmac and go for low-level grass. Change with them and still have the same relationship. Don't get angry that your relationship has changed. Number 5, come
on. Don't leave them behind, because one of the things that people may do as their pet starts getting older, they get another dog or another cat, because they also are being protective of their heart. They don't want to lose everything all at once. So if you are going out with your young animal, don't forget, you've still got your your other
I
pet
think
at
nearly all
home.
the CAM followers, we've got the most beautiful group of followers. We've got 21,000 people follow the main page now. We've got over 3,000 in Holly's Army. Not one of them things like that, which is fantastic. And I'd like to also big up Holly's Army because you've managed to deal with the taboo of using dog trolleys, in that we regularly have people that have got larger dogs. They've been really worried about other people's opinion of them putting their Rottweiler in a trolley and going for a walk. That Holly's Army group has got rid of that, which is fantastic. So I'm going to jump on to number 5, I think it is. I think. Start, because we're talking about comorbidity, this is the thing. What I would suggest, as you say, is using the different therapies, but please communicate with your vet what you're up to. So I see this quite a lot on Holly's Army, where people, the fear factor comes in, people start clutching at different opportunities, different avenues of benefit. And they then get a very confusing picture, and sometimes things might not be ideal. So, for example, if you were to put your dog on a supplement that you believe is all very, very good, it might not agree with both conditions. So when you go to your vet, make it clear everything that you're doing. Even if you think it's quite benign, still flag it up. Number 4.
One of the big things that I like to do as well is, if you have the older pet, don't hesitate, and this is from the owner's perspective, don't hesitate to use things like towels or slings. You spoke about the cart.
Yeah.
You can use things that you have laying around the house to help the pet get up. That's one of the big things that I look at with myself. I get out of bed in the morning. I don't jump out like I did years ago. You know, I sit on the edge of the bed for a second and then I stand up. Well, your dogs and cats that are old, what they can do is they may have a hard time getting up. And so you help them. Don't just sit there and go, oh, you lazy, good for nothing. You can go over and help them get up. And
Yeah.
it's just like with old people. Once they start moving and get going, a lot of times they walk out of it and they're walking along doing fine. So help them, don't hesitate to assist them in any way that you can, because they can get up and enjoy life better. And as you said, talk to your veterinarian. And one way back thing that you said, which is excellent, is a lot of veterinarians that specialize in pain management, they make their appointment times longer.
Yeah.
So they're not seeing the pet that gets vaccinated and is in for a wellness visit, and they're there for 15 minutes and out the door. If you're doing any kind of pain assessment, it's going to take longer. And that's what you want to do. You want to
Which
see
is
somebody.
really exciting, because you're saying exactly what I'm seeing happening in the UK. So for all your new CAM followers, I've been obsessed about arthritis and pain management for about 4 or 5 years now. So I read as much as I can. I'm looking at all the magazines. I'm looking at what's happening around the UK. And we've had a real flurry of chronic pain or pain clinics at referral centres. So we now have nearly every referral centre I know has somebody that's got real focus on pain. And it is becoming more normal for first opinion vets to refer for improved pain management, because it's specialist. It's hard to get that balance when you're using multiple drugs. I've also seen a lot of practices becoming more interested in offering their own pain clinics, which have extended periods so that people have more time to talk. There's more chance that people will get a questionnaire before their visit, so that more information could have been exchanged beforehand. So that owner's thinking like the vet, and the vet is thinking like what the owner was seeing. So that's really good. So it's a really, really positive time. I'm going to scoot on to the next one. I think I'm number 4. I'm going to relate to how I felt. It was very difficult, and I needed to have moments of happiness. And you can have joint happiness. Interactive feeding toys, hide and seek, silly little games. So in the morning, I used to do things like get a load of paper, and I'd get her food, and I'd wrap it up in little balls of paper. So you'd have 30 balls of paper with one treat in each ball. And it was just like Christmas to her. And that made me happy, and it made her happy, and it made her move. And she was still moving the body, which we need to do. Leaving them laying in periods for long periods of time, not ideal. Keep them moving. But that looked after her mental health, and it certainly looked after my emotional mental health. So be kind to yourself. Number 3, we're nearly there.
When you are with your pet, don't hesitate to let yourself be emotional.
Oh, yes.
Because, you know, when you don't allow yourself to recognize what's happening, as it gets closer and closer, it hits you harder and harder. So allow yourself to grab them and hug them, and they love it all the time. You know, it doesn't matter when you choose to give your affection to them, they love it regardless.
Yeah.
But allow yourself that time to need special time with your baby, because you know, there are many people that their lives are so rushed. When it gets down to this, well, I will. So this is number 4 or number 3?
You're number 3. So we've got one more each. Save it.
Okay. Oh, okay. All right. I'll save
do one,
it.
and then you save it, and then that's the last one. So
Okay.
my number 2 for you guys is something that I never heard about, and we'll probably touch on a bit in a minute. There's something called anticipatory grief. And for about 2 years before, well, 3 years, maybe even longer, before it happened, I would just not be able to think without being hugely emotional. And I realized that that actually overlaps heavily with something called decision paralysis, where because you're so caught up and you're so emotionally involved about what might happen or it will happen, but when will it happen and how bad will it be? And I never want this day to come because I'm too in love with my dog. But it actually affected my ability to make decisions. And I really needed to have a good group of people around me to help me make those decisions. So get your group of confidence. I'd like to say that if you feel that you haven't got anybody close to you, then please go to Holly's Army. They are absolutely lovely. And the page, the group, is overseen by another lovely group of people called Cambassadors, and they get private tuition of how to look after you. So if you are feeling that you need that kind of just a little bit of support, those confidence that are going to help you make decisions when the going gets tough, because decision paralysis is a real thing. You just get stuck. You don't feel that you can go forward. It's a kind of little bit of a compassion fatigue, and there's so much going on. Surround yourself with good people. Number 1, your last one.
Don't hesitate when you are starting to get into this place, looking at arthritis. Read everything you can. Now, I'm not saying do everything, because as you said, one of your points was let your veterinarian or your hospital know everything that you're doing. But I read things on the human side all the time. And I think to myself, can I apply that to a pet? Can I apply that to an animal? Because they're doing magnificent things with people.
Mm.
And reading about a person, it doesn't hurt to see and try to look at it and say, well, is it impossible to do that? Now, I'm not talking about on Facebook, because they, which I didn't realize initially, on something like Facebook, they look at different things that you go to,
Mm.
and they will show you ads for things
Yeah.
in your follow-up. For, as you're scrolling along, they'll show, oh, well, you went and looked about a specific carrier.
Mhm.
Let's stick carriers on there for her. So be careful, as you said, about falling into traps. But I love to research and read about whether it's human or animal,
Well, I
and
think that's
think,
a really good. I think just to add to your worry about Facebook ads and internet ads, there's a really wonderful lecture online by Zoe Belshaw. It's free of charge. It's an hour. It's done by the Hills Group. It's a global symposium. It's 2017, and she talks about the fear of Dr. Google, and actually how Dr. Facebook is even more scary. And what we all have to realize, guys, is that the internet is channeling us to be useful. And that might be that we're being channeled to buy something eventually, or we're being channeled to sign up to something, or we're channeled to like something and up someone's rating. We are useful. So our observations, our presence, is being manipulated. So when you're at home late at night, your dog's had a bad day, and you're sat there on the sofa and they're sat on the floor, and you get your iPad out, you get your phone, and suddenly all these products appear right within grasp. They're easy to purchase. You just click and they're going to arrive in a few days. Be careful, because generally there's a lot of crap out there, and I'm going to say it, there is a lot of crap out there, so please look after yourselves. With regards to what you were saying about Reed and the correlations with human pain management, I think that's brilliant. Let's tangent there for a little bit. Humans are becoming more and more aware of how powerful the brain is with regards to pain management. Distraction, occupying your mind, mindfulness, all of this sort of thing features really heavily now with people with chronic pain conditions, about mind over matter, because pain is perceived in the brain. This is where all of that information, it's here which decides that it's going to be interpreted as pain, and your previous experiences make it worse. So if you've had a bad experience at the dentist, I can assure you the next time you go, the pain will feel worse, because your previous memory will influence how bad it feels. Where am I going with this? What's quite important, we haven't really touched on it in animal medicine yet. How powerful is distraction for pain? How powerful?
very, very. I will
Exactly.
give you a classic example. Okay, so people may not know about this. When animals are coming out of anesthesia, there is something called dysphoria.
Mhm.
They can be waking up and crying and, vocalizing, thrashing around. And one of the things that's very helpful for the nursing staff is to know, how do you distinguish whether it's pain and they need more pain medicine, or how do you distinguish if it's this dysphoria? Well, the way you can distinguish it is the animal, that if you go sit with them, hold them, try to soothe them, if they become quiet and settled down, that is the animal that you're thinking about with pain.
Mhm.
The animal that thrashes around and you talk to them, they're not focusing and looking at you, that's the animal that could be having this
I
dysphoria.
think that's amazing. That's a lovely,
And
example.
and there are things that articles have been written now in veterinary journals about dogs like certain music, cats like certain music, Music can be soothing to your pet. Talking to them can be soothing. Listening to other people speak can be soothing. Things like that can be extremely helpful and get them to think about with people when they talk about, if you're geriatric, maybe not even geriatric, but you have a condition, and physically you get the person to think about something else or distract them.
100%.
That works for animals too.
Yeah.
It can help. Now, I'm not saying that if they're in severe pain, that talking to them and playing music for them and that kind of thing is going to make it all go away. But what it can do is it can help them to not focus on it 100% of the time.
Yeah.
And that's a big thing to help with their state of mind. I've looked it up and spoken about it. Animals can get depressed just like people. Now, is it the exact same way? No. However, here's a good one. Let's say your dog is older and you take your younger dog, or you just quit and leave them at home. They still like going out in the sun. Even if all you do is help them get to the backyard to lay in the sun or go lay in a shady area, they like laying there and looking around and seeing their environment so that they're not stuck in the house alone. And those are the animals that get depressed, the ones that you just leave them alone, leave them behind.
I don't think, I can honestly say that all of the things that I read on CAM, you know, it's very, very rare that I see posts by our owners that have that kind of attitude. They're in CAM because they're trying to find more ways that they can positively influence their dog's condition, be it their dog's 8-month-old Labrador and they've got a life ahead of managing, say, severe elbow dysplasia, or we might be a 14-year-old little terrier who really is beginning to struggle with the dementia and the arthritis. We've got fantastic people on CAM. But I do think you're right that there's an area of veterinary medicine that doesn't scream academia. It doesn't scream complexity, and it doesn't scream this is really technical and I've spent 6 years learning to study this, so this is hard and they're going to be impressed with how much I know. The area that I'm really good at is the simple stuff, and the simple stuff, which is enriching their environment, changing your routine, doing the little stuff that
compassion.
The compassion. What makes you happy, it makes them happy. You know, Luna's had a terrible day today because she got hip scored today. But before that happened, I was having a bit of a bad day and there was a few tears at work and she was all over me. She was like, what the hell's going on? You're so sad. I can't deal with this. And so by doing something that makes me happy, I know it makes her happy. We're very interlinked. So my absolute love is trying to encourage people that these little things, bringing in scents from the garden, putting them in the trolley and taking them for a walk, get the author pets, help them up harness and take them for a little stroll in, you know, ankle deep water, so they've got all the crazy sensations and the smells and the breeze. That is still a form of pain control and it shouldn't be overlooked. So
oh no, absolutely not. I can think specifically, now this is not arthritis, but there's no reason you couldn't put that condition in there. German Shepherds, certain dogs can get a neurological condition called degenerative myelopathy. And what it is basically is it's Lou Gehrig's disease in animals. It is, you know, it can be an animal model, this degenerative myelopathy. These dogs, it works up the spinal cord and they lose control until it eventually works up to the respiratory centers. And just like with Lou Gehrig's disease, then they can't live any longer. However, These dogs can go out in a cart. I saw a woman that filmed. She had 4 German Shepherds. She had 3 that were younger and this one dog that was in a cart. She took all of them out for a walk every day.
Yeah.
And the dog in the cart went right along and was as happy as it can be. And see, that's worth knowing and worth thinking about. Your pet doesn't have to just lay in the house and be miserable. They can still get out. They can do stuff, but be
And I think it's a
realistic.
market that we just haven't tapped into. So pets at home, who's your big pet care kind of like pet toy provider? We've got things like Pets at Home and Pets Corner. Get your OA dog product range out there. We need a lot more focus on these interactive feeding, these different texture, different noises, different kind of interactive toys and products that are aimed at this area that has got very, very little attention.
There's a company in the US, I don't know if they're international, they're called Chewy, Chewy.
Okay.
And they have a huge number of products on them. You know, Amazon does itself. If you go look through the stuff that's on Amazon, now I'm not saying go out and buy your animal 10 million toys and do all that, you know, but be selective. And the enrichment stuff that you're talking about is a big deal. You know, I mean, it really is. And so there are a lot of pets that are out there that can benefit just to be included in what you're doing and not left to be alone. So
and that's what I think CAM was originally created to make sure that there was a resource for all owners, no matter how much you can afford, what you're physically capable of, what you're emotionally capable of, what you're intellectually capable of. There is a resource that you know there is going to be something there that you can do. It might be putting rugs down. It might be taking the cushions off the sofa, stretching a nice blanket over and making them a pretty decent bed with a backrest against a wall. It might be that you start lifting them in and out of the car rather than having them jump. These things don't cost money, but they make a massive, massive difference to this disease. We've hit an hour. I'm really quite aware of not burning you out because I want you to come back. Because these chats can be really, really helpful for people, especially some of our followers that are far and wide. You know, we've now got quite a few followers abroad that may have less availability. You know, their vets might be further away. They might not have clinics. They might not have therapists nearby them. The products that they can have access to might be a bit limited. So these chats are really kind of to try and help people all around the world know that there's other stuff that you can do. I think we'll leave it here today, but can I get you to come back and we can talk a bit more about something that I think is a whole topic, euthanasia. You know,
yes,
unfortunately, we do need to do that at some point, don't we?
yes, and I'll be glad to talk about the biggest question I get from owners, for instance, like you, when you were thinking about what's it going to be like down the road for me, is how will I know that it's time? So I'll address that with
Perfect.
owners that need to know, because that is a huge fear inside, you know, and it can, you know, it can cause the owner also emotional upset. And you think, I want my pet, I want the best for them. So I'll be glad to address that with you.
What we'll do is I'm going to put below, guys, the Lap of Love address, the International Association for Hospice and Palliative Care. I'll put a few links to assessment tools, so these ways that you can monitor your dog's progress. Don't think of them as being a negative. Often people go, oh my God, he's improved. I thought he was getting worse. And I'm like, yeah, it's because you're in the mindset that they're getting worse. But actually, quick little story. Only last week, I had a gentleman that came in to where I work, and he was convinced there'd been no improvement after we'd done our stem cells, and we'd done some serious physio, we'd done some hydro, and we're doing laser. He said, "Oh, I don't think it's really working." And luckily for us, we do gait analysis, so we video them, and we were able to get the video up of how the dog walked prior, and he was like, "Whoa!" There was a massive difference. But when you see them every day, it's very, very difficult. So don't see that these tools are a sign that you're going the wrong way. They can be a tool that helps you go the right way. So don't have a negative angle on them, okay? But I'll also put a few other bits and bobs, and then what we'll try and do is come up with a date between me and Mary that if you've enjoyed this, we will be back and we will talk further. Thank you, Mary. I'm really grateful. You know, you stepped in last minute for me, and that I really do owe you a beer when I come over to Florida sometime.
Wonderful. That's terrific. Thank
Cool.
you
So
very
thanks,
much.
guys. Good. And we'll see you Sunday for the talk with Stephen Sital. We're going to be talking about CBD. It's a very, very difficult topic. So
Don't miss him.
nice.
Don't miss him at all. I'm telling you.
He's quite a character.
He's a character, but he's also a brilliant young man. So don't miss it.
Perfect. Righty ho. We'll see you later, guys.
Bye-bye.